Thanks for the rescue. I like that bulldog. Oh, did you do some indentations? You did some indentations.
Oh, yeah. Well, and then the ones.
Did this do auto for you?
Yes. But I had to go back in and I had to format the stuff that was already in there prior to the beginning of the program.
Morning.
Morning.
How's it going?
So, it kind of worked.
Good. How are you?
Good.
Richard Wright called me a while ago with Dulcie, and he goes, "What the hell?" He goes, "Didn't they just get in?" And I said, "Does he understand?" I said, "Well, what else is?" And I picked up the phone. I didn't email him back. I said, "The thing is, Richard, that he doesn't understand. He pays in 12,000 that he doesn't want to pay, but to break the contract, it says in the thing you got to pay $10,000. So, but then to not pay that $12,000, he's losing $135,000 of federal funding."
Okay, they
Turn
should be
up
able to hear you.
There goes that door. Yeah, get her out of here. So I gotta just join the audio you said?
Yeah.
You can come in and bring me some coffee.
Ask them if they can hear you.
Well, when they start the
Yeah.
Hey, Judge, it's Juan. We can hear you.
excellent. Good morning, Juan. How are you?
Doing good, sir.
Excellent. How was your weekend?
Not bad. Not bad at all. Just keeping busy.
Good. That's all we can do. Stay
Yes,
busy.
sir. Yes, sir.
Hello. Hey, good morning, Ventura. Ventura, good morning. I guess he couldn't hear.
Good morning, Judge. This is the sheriff.
Sheriff, good morning. How are you?
Fine, Judge. Thank you.
You okay?
Yes, sir. I'm proud of you guys. You're doing a really good job.
Yeah, I still don't have any asphalt, you know, they haven't released it. Whenever they do.
Yeah.
We're still late for Dr. Nismo. Yeah, on
You only have to get started at 1.
We can get started.
We have to get started. We have to get started, it's gonna be on.
I gave everybody this is just a pamphlet on the mitigation strategy for the community. It's just something we all have, you know.
Do I have to start it, Commander, or? No, he's gonna start. Okay, so, where's that? There he is.
See.
You ready, Judge?
Judge, can you hear me?
Yes, sir.
Okay, just to let you know, Donna said Dr. Nissenblatt's running just a little bit behind, so he should be ready. He's seeing one last patient.
Can you start the meeting, Judge, and then we can proceed, you know, whenever.
You're muted, Judge.
Judge, you're muted.
Judge, you have to unmute it.
Okay, here we go. Could you, good morning, commissioners. Mr. Garcia Ventura, could you lead us in the Pledge of Allegiance, please?
Pledge allegiance to the flag of the United States of America.
Can y'all hear me?
One nation, under God, indivisible, with liberty and justice for all. All are protected flag. I pledge allegiance to the one faith, under God, one and indivisible.
We're ready.
Okay, we have a hearing of visitors. Do we have any visitors today?
Are you gonna speak up? Are you gonna speak in the, before the meeting?
Do you want to talk about the?
Okay, yeah, I can,
Judge,
I can't. Give me my agenda.
Judge, this is Sheriff.
Sheriff, good morning.
Good morning. Just to inform you, very brief, we are fully staffed with dispatch, jailers, and officers. We also have a count of 52 inmates and 3 females. We are also on phase 3 of our Motorola project, our radio system and tower system that you all agreed to purchase. We have an agreement with Sheriff Ramirez from San Diego regarding some of his felony inmates in the event that arrests are made because his staff has been infected with the virus, so he has closed the facility for a couple of weeks. We'll find out when it comes back to normal. We're also working on a project with Commissioner Margie Gonzalez on a special operation with the investigators and patrol division. So that is something that will probably take place this week. So I will keep you informed when we do accomplish that goal that we want to achieve. But other than that, operations are well. Fully staffed administrators are doing well. They've been tested. Everything negative.
Excellent, Sheriff. Thank you.
Thank you, commissioners. Thank you, Judge. Have a good day.
Thank you, Sheriff. Have a great day.
Good morning, Commissioners. Good morning, Judge. Good morning, Sheriff, everybody, President. Good morning. I handed out some flyers.
Good morning, Mr. Sosa.
It's from the CDC. It's on implementing mitigation strategies for the local COVID-19. And the second and third page, it gives you on the level as a community, what we have to do to stop this. We have 4 different levels. So this is just some FYI for y'all guys. Also, I'm sending out on groups as I get these flyers. You know, we need to print them and post them. I saw that the audit department did. And another thing that's working effectively, is other communities are doing it, they're using Facebook, they're using Twitter, they're using the radio, Instagram, to share the knowledge on so people don't know because they don't get out. So that's just some other stuff we can do, and also in Spanish, you know, for people who read English, you know, so we can let information out to our community about how to stop the spread, because, you know, a couple of last month, people were not wearing masks or anything at Walmart, you know, and now everybody's wearing masks. It's about being proactive and not reactive, so we can be proactive and start spreading out these things that it might help a little bit. That's something I have.
Thank you.
I apologize, but I'm sending it out on the group, because a lot of people are not looking into the group. Like the performance that's the world. Thank you.
Thank you.
I think it's important that we educate the community and during this because without
Commissioners, we have Dr. Nissenblatt ready at this time for his presentation. Are we ready? We're going to proceed to agenda item number 4. Is that fine?
that's fine.
Okay, we're going to move on to Dr. Nissenblatt. Dr. Nissenblatt, are you with us?
Yeah, I'm here. How are y'all doing?
Good morning, doctor. Thank you for
Good
your
morning.
time and for sharing your wisdom and your knowledge and your time and your experience with us, sir. Appreciate it. Welcome.
Thank you, Judge. Thank you, County Commissioners, for having me. I'm going to go ahead and just start the presentation here. Are you able to see this?
Yes, sir.
Yes, sir. We see you.
All right. Are you able to see the slide presentation?
No.
Yes.
No, we can't see the
Yes, sir.
slide first.
Can you?
No, we just see you, doctor.
Michael, can you get them to share our screen?
Robert, we're ready to share screen, Robert.
What you need to do? Put the doctor, put your screen.
Doctor, you all need to share your screen.
You all need to share.
I knew this was going to be in
They have to give them.
There you go.
There we go. There we go, Miss Tucker and Donna, we got it.
I get rid of it. All right, so we'll go ahead and get started. So we're going to be talking today about the coronavirus disease, COVID-19. I'm going to just kind of review a little bit here on the virus characteristics. This is a novel virus. We do have other coronaviruses that we've always kind of dealt with. And previous years ago, we had the SARS, COVID-1, and then we also had the MERS, which was the Middle Eastern Respiratory Syndrome. Those actually flamed out pretty quickly just due to the severity of them. It was so deadly that it just killed, and then it wasn't able to spread. This is an RNA. It has a single-stranded RNA genome. That's important for testing to understand, just because it can quickly denature. So typically when you're doing these samples, that they have to be put into a special transport media. Other viral characteristics, it does have an oil-based envelope. That's why you'll see the recommendations to wash your hands and hand sanitize, because that oil-based envelope protects it. And as you can see, is that now that we're into the summer, that oil base has to be helping get through the summers. Right now, we're not getting any flu, you don't get any colds right now, and so forth. So washing hands is definitely important. It's easily aerosolized, so that means it's airborne. Just even with just talking with someone close by, you can pass it through your breath. It does bind to the angiotensin converting enzyme 2, and you'll see a lot of these receptors on your lungs, but also in the GI tract and other systems of your body. Contact, as we all know, touching contaminated surfaces, small droplets from cough, sneezing, even talking. Recently, probably in the past month, they noticed that the virus did mutate a little bit, which made it more contagious, but its virulence has remained unchanged. So it's not any more deadly, it's just more contagious. And the seasonality is still unknown. It went through the flu. It went through the winter season, gone through the spring. Now we're in the summer. And so, this may be, this virus may be sticking with us for a while. Clinically, things that y'all will know, the incubation period typically is about 5 to 6 days, but it can range 2 to 14 days. And that's why you can see that sometimes when we have people in quarantine days, 97.5% of the people who are going to have symptoms will present with for 11.5 days of infection. Okay, so that's also an important number to kind of remember. The problem with COVID-19 is that about anywhere between, you'll see numbers between 20 to 40% of the infected persons either asymptomatic, means that they will not have any symptoms through their infection, or they're pre-symptomatic. So that means through those, that what I mentioned earlier was at 11.5 days of infection, they don't have any symptoms, but during that time they're spreading the virus. So someone could go, let's say, 8 days with feeling great. They have the infection, they're infected, and they're spreading the virus. And it's not till the 9th day or 10th day where they start to have symptoms. But now they've gone 8 days communicating around the neighborhood and so forth, and just spreading the virus. So the one thing also that's recently come up, that we now know that an asymptomatic person, a pre-symptomatic person, and a symptomatic person, all infected with COVID-19, they all shed the same load of virus. So if you think, well, I was asymptomatic, do not attribute that you're not having symptoms, that you're not secreting the virus. You're secreting as much of a virus as someone who is symptomatic. And that's hugely important to understand. So some of the things that the government has been trying to do to prevent this human-to-human transmission is to, smart or limited travel. So I know that certain businesses and so forth have instituted some restrictions on traveling. You want to limit the gatherings, that's, educating the community on those gatherings. Close non-essential businesses, example, bars and gyms, or have, especially like gyms, modify their training to outdoor activities. And then, continual education. You've got to keep reminding people, hand washing, using hand sanitizers, making those readily available, using facial coverings and social distancing. And then the other one is making testing available, readily available. So on this graph, if you look at it initially without mitigation, that's actually kind of, you see that high peak and then it kind of flattens out. And so that high peak is kind of what you saw experiencing in New York and in Italy. They got slammed hard. And that was because they're typically the ports of entry into the country. So typically the West Coast, California was pretty much directly hit with from China, and they're saying that based on the mutations that the East Coast was hit more that the virus came more from Europe. But because those areas are ports of entry and the high density of population, they got hit hard. The hope was with the rest of the countries that, with using those interventions, that you could lower the number of cases while at the same time increasing your healthcare capacity. So that if you remember back in March when New York was getting hit, they didn't have time really to increase the healthcare capacity. So they got to a critical level and, just a high fatality. This is kind of a little bit of what we're seeing right now is that, we get this initial surge and then we try to implement, and I'm going to talk about the timeline of the graph I'm going to show you, but you get this initial surge and then you try to do the social distancing and so forth. And then what ends up happening is when we start relaxing, the interventions, you start to get this resurgence. And I'm going to talk a little bit about that, the numbers that we need to get to avoid that resurgence. So what we have to do is test. Right now, because there's such a huge surge around the country, especially in the southern portions of the United States, we're seeing a lot of these national labs that are performing these tests. They're just getting inundated. Typically, when we first started testing, we were getting test results back in 24 hours, 48 hours, and then it just started to increase to 48-hour wait time to a 3-day to 5-day out to a week. And then possibly about, I was thinking about 3 weeks ago, 3 or 4 weeks ago, about a month ago, CPL Lab, which is Clinical Pathology Laboratories, came out nationally and said, hey, we're so far behind on our labs that we're going to have to shut it down to get caught up and also to accumulate more reagent for the testing, excuse me. So, and Quest Diagnostics, I think they're way behind on their testing. And Quest Diagnostics is now, as a turnaround time is over 2 weeks. And I just saw recently that the FDA just approved for Quest Diagnostics to do pool sampling. So what they'll do is they'll take 4 swabs, obviously from different individuals, and they'll just run one test on for 4 people. And if that test comes back negative, well then great, you sped up time. If the test comes back positive, then you can call those 4 people back in and have them re-swab to figure out who out of that 4 was actually positive. So you can speed up testing, and that would probably help with the turnaround time. But once you start getting that far out, especially if you're not getting 48-hour, 72-hour turnaround time, it really starts to hamper what you're going to try to do to mitigate, and try to contact trace and so forth, because these people are still probably out there around, and that's what we've been doing. A lot of times people say, well, I got the coronavirus and, it was like the flu. And most people, it will be either asymptomatic or mild symptoms. You're probably looking at maybe about 80% of the people. The problem is, and this goes back to this being a novel virus, it's brand new. We do not have any long-term, there's no way, it's brand new. So there's no way of having any long-term knowledge of how this affects our body. So, but what we are seeing from previous cases like the SARS and the MERS, that these people potentially will have long-term lung problems. They definitely can suffer from heart damage. There are some short-term complications that people are now reporting. They describe like a brain fog, some mental effects, possible long-term kidney problems, and so forth. So it's not just about, well, I had a mild case and it went away. These are going to be things that it may not hit national news or media 2 years down the road, 5 years down the road, 10 years down the road, but it's going to be something that we're probably going to be seeing in our medical journals for years, probably the rest of my career, because we just, as of right now, we don't know the long-term effect. People who have the coronavirus will probably be studied and monitored for years on end and so forth. So our hope is that people understand the severity of this and not look back 5 years from now and say, wow, I wish I would have known. What we tried to tell you is that you don't want to catch the virus because we don't know what the long-term implications are. Other things that we're seeing, just because, people are either scared to go to the doctor, people have been at home, but we're definitely going to see some issues probably coming up with kids not being immunized or they're being under immunized. So typically with kids going back to school, they have to have their immunization up to date. But when kids are out of school, then there's that urgency or that need to have their immunization. So that's something that the state is working on to make sure that parents do not forget to get their kids immunized. Kids typically over 2 do not need to be seen in the clinic. Actually, now they've approved that their visits can be done online, and then they can just get their immunizations in the car. So they're not a concern. They're 2 years of age, so they're sure that we need to come in most at risk. Now, one thing, this is a very important graph, and this is a shifting demographics. If you remember that most people, if you talk to people early on in the pandemic, people say, well, I'm not worried about it because this is only going to affect the people that are 70, 80 years old. But if you actually look, this is actually from the state of Texas. If you actually look at it, and these are the age groupings of confirmed cases, we've now shifted. We've now shifted to that age group of being from like 20 to 60. And a good portion of those are the 20 to 40 age group. So that's important to understand because now it's not so much that the elderly are catching it, because those are pretty much, we're doing a good job of trying to maybe sequester these people off and set them aside and protect them. But this younger age group, that 20 to 40 age group, well, these are actually the parents of our school age kids. And so you can see that if the parents are infected, they're going to get the kids infected. And that's typically the mode of transmission, that the kids are going to get it from the parents. So that's a concern for the school districts. You have to really educate parents to realize that if they want the schools open or if we're going to be moving forward, that we have to do a better job. And obviously they got to stay, out of places like bars and restaurants and so forth. And hopefully the state will, pull those back so that we can move forward. This is the graph that just came out a little while ago. It's from Johns Hopkins University, and as you can see, Florida is, they're getting pounded right now. They're considered the epicenter of the virus, and Texas is right behind them, which is not where we want to be. So the hospitalizations, that is actually a true measure of what's going on with the pandemic. And if you can see on this graph, this is actually gives you a pretty good idea why they call Alice is the hub city. And we're actually, we're pretty much in this hub of where the coronavirus is really hitting us. So we have, if you look at Houston, and the reason why I keep bringing up Houston is because we have quite a few split families that have, so the parent and the child may live here and the father may live in Houston. We also do this with the oil and gas industry. There's a lot of commerce that goes back and forth to the Houston area and comes back here and so forth. Same thing with San Antonio up to Austin. We have a lot of, obviously we have a highway that just goes straight up to San Antonio and so forth. So that's one of our destination spots. Laredo is also getting hit very hard right now with the coronavirus, where their hospital's full, and Corpus is considered one of the worst counties per capita in the United States, and they're hurting right now. Valley also is also being implemented. So the one thing I did want to point out for the county commissioner is that we have these highways that run right through Alice. Essentially, you got 281 that comes right down through Alice, and you got Highway 44 that comes through. And so there's a lot of this movement that goes through there. The one thing that I would say is about protecting our community, or when you're talking about protecting, the further out you're in the rural area, you're kind of creating a bubble for yourself. So Alice, unfortunately, runs through these highways. And we have the smaller communities that also run along 281. Orange Grove is offset a little bit. They don't have a major highway or so forth. The only concern I have for Orange Grove would be, them going into Nueces County, and which can be very frequent. So my warning for Orange Grove is that if they want to, lighten their load, they really need to inform their residents that they need to try to stay out of Nueces County as much as possible and take advantage of their rural setting, and that they're offset from that hub component that Alice has to deal with. Now, here's the thing, in leading up to, so these are the local responses, or not the local, these are the responses to the surge that they're seeing in hospitalizations by counties and regions. So Houston right now is in phase 2. They have 3 phases. Phase 1 is a non-pandemic ICU configuration. They're currently into phase 2 of their ICU configuration. So they're expanding their ICU capacity. The I-35 corridor, recently the feds and in conjunction with the governors, we have the FEMA nurses. I do know that I think Austin is, they're obviously preparing ahead of time. They're preparing the Austin Convention Center as an alternative care site. And San Antonio also has received U.S. Army nursing to handle their critical care, med-surg nurses and respiratory specialists. Laredo has run out of hospital rooms, so they're now converting Red Roof Inn into a temporary COVID-19 hospital. The Valley's sent Navy medical personnel, and Corpus, there's been news that Corpus was requesting for, I believe, a naval hospital ship to be brought in, but right now that's on hold. I think right now they're just requesting more oxygen, more ventilators, PPE, dialysis machines, and they're hoping for a federal field hospital. In Alice, we currently already have FEMA nurses in the hospital assisting with staffing. So, so the local impact, we always have to consider that Alice hospital is a rural hospital. So so one of the things we always want to consider is there is a difference between receiving the best care and receiving the best care available. So that means the resources that are on hand. So that's important, because if you do go into the hospital, we want to make sure not only that you survive, but we want to be able to minimize any damage to prevent any long-term sequelae, long-term complications to your health. And then we need to keep a good pulse on what's going on around us. So let's say we have a patient and they become more and more complicated. What is the ability that we will have to send, such patients to a higher level hospital? Are they too full to receive any, or where you get hospitalized is where you're going to have to finish your therapy or your treatment. So the summer, this was supposed to be our calm before the storm. Fall season starts in 10 weeks exactly. So what we're going to need to work on is to make sure that we try to, really go into the fall winter season as healthy and as possible. Because we potentially, based on what we're seeing right now, and we're in July and 100 and something odd degree heat, because we already have, FEMA nurses here, because our system's already being strained. We could end up going into the fall winter season with a potentially fractured healthcare system. So the other thing is reason what we're talking now is because, right now we don't typically see these viral illnesses like the flu or the common colds and so forth. But there's a concern because we're going to be heading back into the fall winter season, and these illnesses can mask looking like COVID-19, or COVID-19 can, present in a similar fashion. So what will end up happening is things that are like colds and flu cases can lead to more spread, more illness, more hospitalizations, and even death. So what's our way out of this? Well, obviously, definitely they're working on vaccine. Hopefully they'll start with the national elections, the federal elections, and so forth. I would be hard pressed to think that they're not going to try to come up with some vaccine. They're looking for at least a 50% efficacy sometime before the election. It would just be hard pressed to see that they wouldn't do a vaccine before the election, but it just may not work out. And so they're hoping maybe by December. So kind of keep an eye out for that. Medicines, people, are touting, remdesivir or dexamethasone and so forth. These help, but they're not curative. And these typically are for the worst cases. So things that we need to do in terms of both on a national and state level, support and explore technical advances, and that includes testing, and then coordinating logistical stuff, testing sites, coordinating with our hospital systems, what resources are available, what can we obtain for our community and for our county, and try to implement best practices, and especially in terms of testing. And I'll talk a little bit about that. Right now you're seeing, and you'll see this promotion, I talked about it before, about this. People say, well, I can get my results back in 15 minutes. When you hear someone say that, they're pretty much talking about antigen testing. Antigen testing is not reliable. It has a high false negative. So someone can go in and say, oh man, you've been told I was negative. If you do any antigen testing, it needs to be done in conjunction with the PCR test. So if you are told you're negative and they did do a PCR test, then you need to wait till your PCR test comes back to confirm that negative. If the antigen test is without a PCR testing, they tell you you're negative, it doesn't mean anything. So you really just need to be doing PCR testing. And then, and just based with the new data, if you're come up with new data points and so forth, you need to be able to prepare for a volte-face, and and change policies based on the information that you have. So we do need to have regular accounting of our regional, local healthcare resource capabilities. And one of the things you can do here in Alice is, find out about our census. Okay, how many beds do we actually have that are capable to handle a COVID overflow? And then what you want to do is you want to find out, of the patients that are hospitalized here in Alice, how many of those are residents from neighboring communities? For example, are we getting overflow from Nueces County? Are we getting any from Laredo? Are we getting any from the Valley? Or are these patients that are hospitalized here, are they our local residents, our local county? And that's important because that'll give you a good idea of what's actually happening. If you find out that everyone in our hospitals from overflow and none of them are from our community, then that's a good sign. If you find out that, you've got 20 patients, the last time I checked, I think the number was 20 hospitalized and 8 in the ICU. I think we were at capacity in the ICU. I may be wrong. Those numbers will change, obviously. So, and I got that probably, that was last week. So knowing that number will definitely help. Going out. And then the other thing that we need to do for accounting is, and I will talk about this, is to be able to get an accurate positivity rate. And so, developing a system where the local providers can submit their PCR testing. And like I said, don't do antigen testing, don't do antibody testing. You need PCR testing to really calculate a good positivity rate. And then summarize those, calculate your positivity rate. And so then that way we can get a better idea, a pulse of what's going on in our community. So our contingency plan, what is our contingency plan if our needs exceeds our resources? So how quickly can we scale up? So for example, if you look at like Austin, for example, they have the convention center and that they're setting that up as an extra care site. If we were to be, especially like right now, you would think, well, it's beautiful weather, it's nice and hot and so forth. You'd say, well, do we really need to do anything right now? What we would need to know from the hospital system is like, well, what happens if we do 200 people that need to be admitted to the hospital this fall or winter season? Could you handle those? And what if Corpus is, if they're already asking for a field hospital, can we overflow to Corpus? And what would be our strain on our transport system of getting, a hospital, the ambulance service to get these people transported and so forth. So these plans need to be outlined and clearly stated so that everyone knows, because when you're dealing with a respiratory or acute situations, that's not the time to be trying to develop a plan, and also developing those lines of communications with our state and federal legislatures to know, like, okay, what does Jim Wells County need? What do we even have available? we do have, we have to, and this is going to be in y'all's field, is like saying, okay, well, we have our spawn system here. And as you know, before, Alice used to be an independent hospital, so then the decisions would be made here in town. As now that we're part of the spawn system, then we're more of a cog in a wheel. And so we wanted to make sure, and that's what the emergency management and the county can assess is, where do we fit in? What is our level of independence and what is our level of dependence within that hospital system? So those are things that definitely need to be outlined and understand, like, okay, what do we do if we're at this point? What do we do at this level of impact? So I'm going to talk a little bit. So I know we've all been battling this COVID-19 now, probably going on 6 months. So why is it so difficult to defeat? Well, let's go back over those physical characteristics. It has that oil-based envelope that protects it. It's easily aerosolized. It's very contagious with varying degrees of virulence. So that virulence, what I mean by virulence is its ability to overcome the body's defense mechanisms. So you can range from anyone being asymptomatic to death. And you can have a prolonged incubation period. So someone who's can be pre-symptomatic up to like 14 days, allowing for unknown spread. And so that's what makes it so difficult. So that's the physical characteristics. Oh, hang on, let me go one more. But I'm going to also talk a little bit, before I go back to that graph, I'm going to talk about the social context. Why is it so hard? Well, there's an ideology that exists, and it's and you'll hear it on the different realms, but it's the ideology of relativism. So it's a false belief that society will be or more quickly reach a utopian or ideal perfection based on the premise of you do you and I'll do me. The reasoning is if you do what you want to do and I get to do what I want to do without any interference, whether real or even perceived, we will both be happy and achieve peace. To live freely without anyone else's restrictions or guidance. It is self-directed and self-driven for self-gain. This ideological mantra runs directly counter and unweaves the fabric of civil and just society. So, and that's what you're seeing. It's people say, hey, don't tell me what to do. I don't want to wear a mask. If you want to wear a mask, you wear a mask. If I don't want to wear a mask, I don't have to wear a mask. And that ideology is why y'all are finding it so difficult and why you get such a kind of a response from people that are so aggressive about like not wanting to wear a mask. Now, let me see if I'm going to go back. So I want to do one thing. Let me go back here. So how do you beat relativism? There's only one way to beat relativism, and that's, believe it or not, that's love. But we have to redefine it to what it actually meant. So love is this temporal realization of pure joy and happiness, gifting oneself for another's betterment. So it's like what Maximilian Kolbe said, let's remember that love lives through sacrifice and is nourished by giving. Without sacrifice, there's no love. So when you put a mask on, you're not just thinking about yourself, you're thinking about someone else. As uncomfortable it is, it's a lot more comfortable not wearing a mask in 100-degree heat or in your office or anything. But you do that because you're saying, I'm going to put myself aside, my desires or my wants, I'm going to put those aside for someone else's betterment. That's love, okay? We all like Whataburger, but we don't love a Whataburger, right? You don't gift your life for a burger, but you do gift your life putting on a mask, washing your hands, and so forth. So that's the battle that you're facing as a county commissioner's court, as a judge, and so forth, is that right now society is really a portion, I'm not going to say all of it, but a portion of society just forgot what really love's about. And that's about not thinking about yourself, but thinking about others. So I'm going to go back here. I want to show you something because this is probably the most important take-home thing that I'm going to talk to you about today. So this is a positivity rate versus a timeline. And so we pulled up all the data. We've done close to 3,000 PCR tests up to this point for our clinic. So what I want to show you on this positivity rate, so what you do is you take all your tests that you've done and how many of those were positive, and you divide those, multiply by 100, and you get a percentage. And so anything considered, if you look at that red horizontal line, anything above 10% is a warning flag. That means you're pretty much out of control. And so when we started the testing back in March, well, let me go back a little bit. We had December when the Wuhan was first recognized. January, there was a fax blast that came out that says, hey, there's something going on. By January 30th is when the pandemic was announced by the WHO. And typically that's when it came into the United States. February, March was typically hitting the coast and so forth. That's when you saw Seattle, California, New York, and so forth really getting hammered. And over that time period is when the virus was spreading into the rest of the United States. And we were able to get all the way into spring break. And it's at spring break when we started it was in spring break when we started the lockdowns and so forth. And that was we were able to kind of do that all the way pretty much until May 1st, okay? And so May 1st is when they announced the first stage of the reopening. And I think May 18th was about the second stage and so forth. And that led us right into, and we had been doing tests through that whole period. And we were actually pretty much, we had one little blip at the very beginning, but then we essentially had nobody testing positive. And we were already doing over 1,000 tests at that point. You know, it isn't until Memorial Day weekend, and it was that national holiday Memorial Day weekend where we pretty much, that's when we started, that was probably the beginning of where we had the transmission that led to the local breach of our containment. And so this little, so then after that, let me just go first here. So we did the local breach, and then after Father's Day, you can just see that now we have surged in our positivity rate. So where we were normally less, we're essentially like doing very well. It's not till recently that we've hit a positivity rate of anywhere ranging between 20 to 23%. So anything above 10% is a warning flag that you're out of control. Now this green line right here, that is your goal, is a positivity rate of 1.5%. So when you look over now at Europe, and they've done studies on this, and they've said like, how are they doing it now? And they actually have not reopened and been able to move forward past the COVID until their positivity rate got down to below 1.5%. So you can see that at 23%, 21, 20%, we are way off the chart. So even if we were to get at 8, 7, 5%, that still is not where we need to be. Our goal needs to be at 1.5%. And that's going to be a challenge, because at 20% heading into the fall, we are coming in way too high for the fall winter season. Because remember, when we were back in March, see, people need to understand something. When we got to the point where we had to close things down in March, well, March 20th is the end of winter season. It's the beginning of spring. So we never really got the full brunt of COVID-19 in a winter season. And that's what we're so fearful of, is because now if we're coming in with a positivity rate of 20% and we're going into the fall winter season, this is going to be a very, very dire situation. So that's, and you can imagine that, you know, we're seeing this 23%, and we're already asking for FEMA nurses to come help us out. You can imagine when we go into the winter season now with a positivity rate that high, this could be a disaster in the making. Let me see here, let me go back. Okay, so how do we defeat COVID-19? Foremost, we need to achieve a 1.5% positivity rate. Well, how do we do that? People need to be vigilant about facial covering. They need to continue hand washing and sanitizing practices. They need to continue the social distancing. And we need, and this is also very important, we need to instruct people on how to create bubbles within bubbles and how to handle breaches. So what do I mean by a bubble? I'm going to just use a personal example. So my house, we kind of consider our family, we consider our house as our sanctuary. That is our safe spot. So we actually posted signs on our doors that says, due to the pandemic, we are not accepting any visitors inside our house. That includes friends, family, except for, and I'll talk about this, except for my parents that I live right behind them. So, but we have an open communication and open understanding that no one's allowed to visit each other's homes. Now, when we do get together, we still wear our face mask and we still try to social distance because the face mask makes a difference even inside the home. So if we can teach people how to create their own little bubble so that it gives them a little bit of leeway to move around, I think that's important. But people have to, within that bubble, have to have an open and honest communication. It's uncomfortable to have the communications, but you really have to know what the other person's doing to actually truly have a bubble. Now, obviously, there's going to be times when you have to say, look, I have to go to Corpus. I have to do something. Okay, well, then you're going to use all the precautions necessary. But once you get outside of your bubble has been breached. If someone comes to your house, your bubble has been breached. And so what you need to do is then you need to self-quarantine, tell them, hey, my bubble's been breached. You need to wait about 4 days, get tested, wait for your results to come back within 48 hours. And if you're said, okay, all the parameters, the safety parameters I took worked, then you can resume your bubble. But definitely bubbles are going to be important just for the sanity of people. I also think for, people need to have that communication, but you need to be able to move a little bit freely. You can't just stay in your home the whole time and so forth. So that's important. We need to test. We need to test as often as we can. It needs to be the PCR, like I said, to get accurate results. And I think, when CPL went down and we weren't able to do the testing at the degree that we were doing before, I want to commend the Commissioner's Court because it just seemed, I don't know if it was by divine grace or however, but it was at that same time that y'all were bringing in the military. And even though the military had been here before, but they really came on when CPL dropped off. And that's a big kudos to the Commissioner's Court for getting that done because that filled a gap. And if we can still get them to come, even if it's just once a week and have like drive-through testing, that's very important for the county to know what our positivity rate is. And that gives the community a goal to say, look, if we can get down to 1.5%, we will be okay. Is it you're going to be 100%? No, but it definitely lowers the burden and the fear factor and the ramifications long-term to people's health. So more PCR testing gives us a better data points to base our decisions. So preparing for the fall winter season, everyone 6 months and older needs to get immunized for the flu this season. I know, previous years people are like, oh, I don't want to get the flu shot. I get sick when I get the flu shot. This is not the year to resist getting the flu shot. The flu and COVID-19, they resemble each other in their clinical presentation: fever, cough, respiratory symptoms. We need everyone to get the flu shot this year because we do not know the virulence of the flu this year. Is this going to be a bad flu season? So if you have a bad flu season and it looks like we're going to have a bad COVID winter, that would definitely put a lot of strain on our healthcare system. And also, if you become co-infected, that means you're infected both with the flu and the COVID-19, your immune system may not be able to handle that. And we may see a higher death rate from that. So, we have been in talks already with the Texas Department of Health, Dr. Pro, and we've stated what our goal is for the county with the Jim Wells County Medical Society. And our goal is to try to get our county with an immunization rate of 80%. Typically kids under 18 is a good capture group. Adults over 65 is a good capture group, but it's that middle age group that really drops off. I mean, you're probably looking around 30% vaccination rate. So getting the big businesses, to get their employees have flu vaccine clinics. We've talked to them. We've talked to the TDH about doing their mobile influenza, so forth, and making sure that all the providers in the area are getting vaccinated, and also having the schools help us with the promotion of getting the flu vaccines performed. So that's going to be very important. We did talk to Dr. Pro, because we wanted to make sure that we were going to get, because there is going to be a push for this flu vaccine, that we want people to, at least in our county, because that's who we're responsible for, is to make sure that they take every advantage of getting the flu shot to get it done. We hope that there's not a shortage of the flu vaccine. So the first that you hear that it's available, that you definitely want to get it. We do know that the feds are going to push 1 million doses, but that won't arrive till November. We need to get, when Dr. Pro mentioned that they were going to get 1 million doses, I don't know if she was talking just for her region, or which is obviously our region, or is that an extra 1 million doses for the state? But I would assume that the 1 million doses would be for her region, which would be a big help. So here's the homework summary. We have to prepare for the fall winter now. So and what we talked about is like, being in close communication with the Spawn Hospital System, the City of Alice local hospital contingency plan, and it needs to be written. So it's very well, and so it's understood about what will happen in certain scenarios and how we build it up. From the standpoint of from the county and the city, you do have the old La Viana Hospital, and I don't know how that's being fully utilized. Which obviously had its own ICU, and it has obviously the 2 floors of the hospital. I don't know where that stands. And then you have the old Alice P&S Hospital right across, which had the plans to be converted into apartments. But if there are federal funds that are available, and the turnaround time and so forth, the city could and the county could investigate if there are any federal funds to get those hospitals up and running. I mean, if you've got Laredo, which is only, an hour and a half away, needing to convert a hotel into a hospital, well then, this could be an advantage where Alice could actually serve as a source for these, these hospital needs, and you have the buildings themselves. So, you can get an army of engineers in here, and they could, essentially get these buildings back up and running pretty quickly. Instead of Corpus having to use a field hospital, you actually have the facilities here. So that's something that, from a medical standpoint, a socioeconomic standpoint, could really benefit our community. And also looking down the road, when you have to deal also with the immigration cases that are down in the valley, this hospital here could serve as maybe a federal health facility for the immigration services. So our goal over the next 10 weeks also is to need to achieve a less than 1.5% positivity rate. So if we let the community know that's our goal, and then we encourage people to get tested, we create bubbles within bubbles, teaching people how to smart travel. You can go online, and find portable urinals. I recommend to my parents, I said, do not go inside any gas station. Go to the gas station, fill up your car, but do not go inside the gas stations. I mean, you have to understand that the traffic is really high in there. And when you go to these gas stations and you're waiting in line, you're probably most likely going to be infected. We got to make sure that our testing is up and running, and I try to get that scheduled if we can be doing, because the more data points we have, the better decisions we can make as a community. And then, like I mentioned, we're already trying to work on a countywide influenza vaccine plan. I know we've had some communication with the county about video education and doing some public service announcements, and that's still in the works, and that's in progress. And the same thing goes with the continual education. We need to just keep that going, try to enroll the newspaper, social media, and so forth, and reminding people of the importance of doing what we're doing to get that number down. Also, I'm going to go back to that positivity rate. They did notice that if a community had a positivity rate of 2 or 3%, which you'd think, oh man, that's good, the cases still exploded. So it wasn't until you got to that magic number of 1.5% where you had things under control. At 2 to 3%, it's still, the cases still took off. So 1.5% is the absolute number. And then if anyone has any questions, I'll be happy to answer them.
Dr. Nissenblatt?
County Commissioner, I have a question on, once a person is tested positive and you go through the 14-day quarantine, how long afterwards do you have to test? Do you recommend you test, that way you can come out?
Can you,
Commissioner,
I couldn't hear you. Can you repeat the question? I couldn't hear you.
Huh? Once a person is in quarantine 14 days, how long does it take to test afterwards so you can come out clear?
Yeah, so once they come out, once you've done your 14 days, you can test right then.
So if a person who has been in quarantine 14 days and you test after that and you still come out positive,
Yeah, so right now what they're saying is in terms of the 14, because there's been some changes, and that's the one thing that you have to do is right now the CDC kind of changes their recommendations. So when the CDC, so if you've been in quarantine for 14 days, what they're banking on is that you've already produced the neutralizing antibodies, that most likely that what you may be picking up may just be a non-contagion, nucleic material from the secretions. Now, the one thing is that when you do look at the CDC, when they talk about, they said, well, when they are sending some people back, and this is what has me a little bit worried, that they said that it's not 100%, so they may actually be sending some people back in the workforce that still may be contagious. But when you're running into a problem with testing availability, they may be doing a risk-benefit type of scenario where the instead of having to do more testing on people that maybe have already recovered, they'd rather move those tests to people who they're trying to figure out if they have it or not. So that's why if you said, okay, if you've been quarantined for 14 days, most of the times they're just releasing them without having been tested. Personally, I would feel more comfortable having been tested. The CDC does have two recommendations. One would be like symptom-free, and you've already had your 10 to 14 days. The other one is that you get 2 negative tests. So, it also depends on the individual's person's circumstances. So when we have a healthcare worker that's positive, those people are going to be in close proximity with other people, then we would probably want them to get tested and have 2 negatives. At least 24 hours apart before we send them back out. Whereas someone who's at home and doesn't really have too much community, outreach, then that person would probably be fine with going with the symptom-free and your 10 to 14 day quarantine.
Dr. Nissenblatt,
Yes.
this is Judge Rodriguez. That was a very thorough, very extensive presentation, and we're very grateful for that. I'd like to get a
Sure, we can
presentation useful. We're going to make that available, hopefully on our website. And commissioners, do we have any more questions or anybody else that's online with us for Dr. Nissenblatt? Our official authority for Jim Wells County. Dr. Nissenblatt, thank you for your presentation and for your time and for very specific and very thorough presentation. Like I said, that was a wonderful presentation. We're grateful for having you part of our community. So, commissioners, do we have any other questions for Dr. Eric Nissenblatt or anybody else? Anybody?
And if they don't, they can always just reach me here at the office. That's fine.
Sure. Okay, doctor. That was very good. That was excellent presentation. I have to admit, I have to say one other thing. I must admit that before this surge and this spike and this sense of urgency and everything came along, I think most folks, including myself and a lot of others, were we're a little weary and not as convinced, and it's just human nature. Now that we're here pretty close to the epicenter and everything that's going on, the latest going on, we're here. And like I said, again, I can't emphasize enough and reinforce the fact that, and thank you enough for stepping up and giving us of your time and your knowledge.
Yeah.
Again, thank you very much, sir.
You're welcome.
Doctor.
All right. Thank you.
Thank you.
Yeah.
Commissioners, we, no more questions. So we can, I think we'll move on to agenda item number 5, consider take action to adopt an order for all public and private school systems in Jim Wells County relating to on-campus instruction reopening. Mr. Guerra. Michael.
Yes, Judge, Commissioners, good morning. Can y'all hear me?
Morning.
Good morning, sir. Yes, sir.
Okay, so what we have before us now, and that's why I'm glad we got to hear from Dr. Nissenblatt, is very informative presentation. Since probably Thursday and over the weekend, we've been in consultation with him, as well as Dr. Scarborough, Superintendent Van Matry, and the other superintendents in Jim Wells County, Superintendent Hoyer, Dr. Barrera and Ben Bolt, and Mr. Braswell at La Gloria. And of course, there's still a lot of uncertainty about what's going to happen as far as schools reopening. TEA has made, I think, 2 changes last week. They went from a 3-week virtual only to 4-week. And then late in the week, they posted a procedure where school districts could ask for an additional 4 weeks if they so desired. They also indicated that if the local health authority chose to prohibit on-campus instruction, that they would honor that, and that the school districts would still get their funding. That, of course, that's critical. Any plan that the school district will make is entirely dependent on having an assurance that they will be funded. With that in mind, we have the order before the commissioners this morning, and this essentially adopts such an order for all the school districts in Jim Wells County and would prohibit in-person instruction until October 9th, which we were shooting for an 8 to 9 week period. Different districts are going to use different start dates, so that's a moving target based on the number of districts we have in the county. So we use the earliest one. We will have, the Commissioners Court will meet 4 times before that date. So if we need to make adjustments, we certainly can, and either move that date up if things get better, or move it back if they don't. So this is what's before us. We have circulated this order with all the superintendents in the county, and we have gotten positive feedback on this. And I, of course, provided it to everybody yesterday. If you have any questions, we can go ahead. I'll do my best to answer them at this time.
Michael, I think you did a great job. That's pretty thorough, pretty concise and comprehensive order. Commissioners, do we have any questions? It's pretty straightforward. We're here to protect our children and our staff, our teachers and the staff, and try to keep this virus as contained and as isolated as possible. And this is why County Attorney Michael Guerra recommended, suggested, and we were on the same page, and I think we all agreed. And fortunately, the state and the TEA has softened their stance and enabled school districts to have a little more leeway, and school boards. So, Mr. Guerra, do you have anything else, or commissioners, any questions regarding this order before we move to adopt this order? If not, I move that we adopt this order for all public and private school systems in Jim Wells County. I move. Do we have a second?
Yes, sir, I second.
We have a second. Okay, all those in favor say aye.
Aye.
All those opposed? This agenda item, this motion is carried. It is passed, and this order is in place. Okay, commissioners, any other questions before we move forward and adjourn this meeting?
I'd like to say something before
I'd like to-
we adjourn.
I'd like to thank-
We have testing in Fremont going on right now till 1 o'clock. There's 300 test kits. And we had our excellent crowd this morning, so it's still going on right now. We'll also have it in Benbow Saturday from 9 to 1 at the high school for all the people from Benbow and the surrounding areas. So just wanted everybody to know about it.
We'll have that on our website, correct, Commissioner?
I'm sorry?
We'll have that on our website and emergency management,
Yes,
correct?
sir. It's up there in my page also.
Okay.
Margie had another one.
Excellent. Excellent. Commissioners, thank you very much. Okay,
Mr. Sosa got a couple of
excellent. We'll
words.
post that on our website. And commissioners, thank you very much. And I move that we adjourn this meeting.
Hey, Judge. Hold on. I
Wait
got
a second.
Coach Gonzalez and
Yes,
Mr.
sir.
Sosa wants to-
Okay, go ahead. I'm sorry for the delay here. I have a little delay.
We have a disturbance around Cuba, and they don't know if it's gonna turn into a depression or not, but it is forecasted to come hit us. So everybody, we need to get prepared ahead of time and not wait for the last minute. We know that last hurricane was supposed to hit us, and they turned away, so that's what they're saying, it's not coming, so maybe we need to let our guard down. That's it, I'm sorry.
Thank you, Mr. Sosa.
Thank you, Sosa.
Thank
I'll
you,
make a
sir.
motion to adjourn.
Okay, second, all those in favor say aye. This meeting is adjourned. Okay, let's go. Go ahead, Commissioner.
Go ahead. I might be asking this question too early, but when it's time, let's say we decide for the kids to go back, you think they're gonna require them to be tested before they go to school?
That's why we'll confer, and that's probably at that time we'll confer with the school districts, superintendents, and the medical professionals before we proceed and do anything that on our own motion. We'll consult with experts like Dr. Nistelblatt and Dr. Emily Pro, our Region 11 healthcare director. So before we proceed or do anything like that, we'll consult with all superintendents, school districts, and everything else before we make any decisions of that nature.
Thank you.
Thank you, Judge.
Thank you, sir.
Thank you.
I'll make a motion to adjourn.
Thank you, everybody. Commissioners, y'all. This meeting is adjourned. Thank you, commissioners. Y'all have a great day.
Thank you.
Thank you.
Thank you.
Information